Opioid abuse, it's a problem facing the nation, and Wilmington is at the top of the list. The worst city in the country for opioid overdoses, and now the Cape Fear is using Narcan. That's a drug designed to bring people back to life more than ever. WWAY's Kirsten Gutierrez explains what it costs you to have this drug on the streets.
It's being called an epidemic. In fact, more than 700 people died in 2015 across the state from an opioid overdose. And according to Castlight Health, a healthcare company based out of California, nearly 12% of people in Wilmington abuse opioids. Now we're seeing an increase in a drug used to reverse overdoses. In a WWAY special investigation, I dig deeper to find out if Narcan is helping or hurting the crisis.
But we've got to focus on these users.
There have been 3 overdoses in my life that Narcan has saved my life.
But we're in the midst of an epidemic.
In November of 2016, a family's life changed forever.
Where a 2-year-old was killed because somebody using an opioid passed out and ran into the back of the car. Just a horrible situation.
The man charged in the child's death had reportedly been revived 4 separate times by a drug that reverses an opioid overdose.
Currently, we have saved people's lives 50 times since our introduction of our naloxone program back in March of 2016.
It's touted as a miracle drug, known as naloxone or Narcan.
That's somebody's child, that's somebody's daughter, it's somebody's parent, and sometimes they need that extra chance on life in order to go on a different path. And naloxone provides that as an opportunity.
It saves lives, but is it enabling more harm than good?
We can't arrest this situation away. We know that.
It's a predicament Wilmington Police Chief Ralph Evangelist is facing head on.
If they're out there and we're hitting them with naloxone and they don't want to get treatment, they're a danger to themselves, and they should be involuntarily committed into some sort of custody to try to get some sort of detox going on and some sort of help.
Community leaders are working together to get this crisis under control. Statistics show Wilmington is the worst city in America for opioid abuse.
We have seen a consistent trend of there being more overdoses per year. The good thing is we're able to reverse a lot more overdoses in the field now, since our agency equipped local law enforcement with naloxone.
The North Carolina Harm Reduction Coalition provides police departments across the Cape Fear region with naloxone courtesy of a grant.
Right now, we have spent not a dime by the taxpayers on this, and that's the direction I intend to go.
As for emergency responders, they're supplied through the hospital by its pharmaceutical budget. They say in the past 6 months alone, they've used naloxone nearly 400 times.
An addict is going to use, and we know that. Not giving them Narcan just means that we're increasing the chance of them dying. And as a healthcare provider, I swore an oath to take care of people. So for me, it helps, because without it, I probably couldn't save some of those people's lives.
Deputy Chief Mitch Cunningham agrees, but questions what happens after you save their life.
It's doing what it needs to do, but in some ways it's now exposed another problem, which is it's not enough just to save their lives. It's equally, or maybe even more important, to get them into some kind of long-term treatment.
One of the next steps is solving the disconnect of how to live a productive life after a near-death experience.
I've learned to be really creative about ways to reach out to people. If you'd talked to EMS years ago about resource sheets on how to get treatment, it wasn't something any of us really thought about.
Michael Page knows firsthand how difficult it is. He was revived 3 separate times.
There's a lot of people in the community that would say, you know, once you've used Narcan once, forget about them, it's a wasted cause, or Narcan enables people, they know that they can continue to use. I would say that we don't have a right to judge. We never know who's going to turn their life around and make a difference. And if it wasn't for those multiple reversals, I wouldn't be here.
Page wouldn't be a father, a brother, or an advocate to get others the help they need.
If I had overdosed and not been brought back, I wouldn't have a life today. So naloxone kept me alive until I was ready to make that change.
It's a drug designed to bring people back to life in hopes of a brighter future. Now the challenge is getting addicts to take advantage of tomorrow.
All right, thank you, Kirsten. North Carolina Harm Reduction Coalition Executive Director Robert Childs, he says in the last year they've used Narcan 1,400 times, and about 5,600 community members have used the drug on their loved ones. For more statistics on the growing epidemic, head to WWAY-TV3.com.